Welcome back. In this video, we'll explore how general practitioners, GPs, and other non-specialized health providers play a critical role in diagnosing and managing depression. Depression is a prevalent condition, and primary care settings are often the first point of contact for individuals seeking help. Therefore, it's essential for non-specialized healthcare providers to have a solid understanding of how to assess, diagnose, and treat depression effectively. Let's explore how GPs can manage depression in a primary care setting. Let's begin by discussing the role of GPs in depression management. As a general practitioner, the first task is to recognize the signs and symptoms of depression. Many patients will seek help for physical symptoms such as fatigue, headaches, digestive issues, or sleep disturbances, which are often associated with depression. Depression can manifest in physical symptoms that may not initially point to an emotional cause. For example, a patient might complain of chronic pain or low energy, but they might not mention feeling down or hopeless. GPs should be vigilant and consider depression as a potential underlying cause for these symptoms. Screening for depression is crucial in primary care. One of the best ways to identify depression in primary care is through screening tools. The PHQ-9, Patient Health Questionnaire 9, is one of the most widely used tools in primary care. It's a simple questionnaire that asks patients about their mood, energy levels, appetite, and sleep patterns over the last 2 weeks. The answers are scored, and the resulting score helps GPs gauge the severity of the depression and determine the appropriate course of action. Another tool that can be used is the Beck Depression Inventory, BDI, which is often used in more comprehensive assessments. However, the PHQ-9 is typically sufficient for identifying mild, moderate, or severe depression in most cases and can be done in the office, helping GPs make quick decisions about how to move forward with treatment. Why are these screenings important? Screening tools like the PHQ-9 help standardize the process of identifying depression, ensuring that no case is overlooked. Depression can sometimes be dismissed as just stress or temporary sadness, but using screening tools allows GPs to accurately assess the severity of symptoms and make informed decisions about treatment options. Reflection questions. How do you think depression-related physical symptoms can be easily overlooked in a primary care setting? How can screening tools like the PHQ-9 help in identifying depression early in a healthcare visit? Once depression is identified, the next step is to decide on a treatment plan. For GPs, the most common treatment for depression in primary care is pharmacological treatment. Medications like SSRIs, selective serotonin reuptake inhibitors, such as sertraline, Zoloft, or fluoxetine, Prozac, are typically prescribed as first-line treatments for depression. These medications work by increasing the levels of serotonin in the brain, which helps to improve mood and overall emotional well-being. GPs may also prescribe SNRIs, serotonin norepinephrine reuptake inhibitors, or TCA, tricyclic antidepressants, in certain cases. But SSRIs are usually preferred due to their favorable side effect profile and better tolerability in most patients. While medications are often the starting point for treatment, GPs should also recommend psychotherapy or psychosocial interventions, like cognitive behavioral therapy, CBT. This combination of medication and therapy is especially effective in treating moderate to severe depression. How can GPs manage treatment for depression? After prescribing antidepressants, GPs should ensure regular follow-up appointments to monitor the patient's progress. These appointments are essential for adjusting the medication, addressing any side effects, and assessing whether the patient's symptoms are improving. If needed, the GP might refer the patient to a mental health specialist for more intensive therapy. Another important aspect of treatment is monitoring for co-occurring conditions. Depression often exists alongside other conditions like anxiety, chronic pain, or sleep disorders, and GPs should be aware of these when prescribing treatment. The goal is to provide a holistic approach that addresses both the depression and any co-occurring conditions. Reflection questions. Why is it important for GPs to schedule regular follow-up appointments when treating depression with medication? What challenges might arise in managing depression in primary care, especially with patients who have co-occurring conditions? Let's talk about referrals and when to seek additional support. In primary care settings, GPs should feel confident in referring patients to mental health specialists when the situation calls for it. If the patient's depression is severe, unresponsive to treatment, or accompanied by psychotic symptoms, such as delusions or hallucinations, a referral to a psychiatrist or psychologist may be necessary. Additionally, if the patient is experiencing significant suicidal thoughts or self-harm, they should be referred to urgent care or emergency services. It's crucial for GPs to ensure that patients at high risk of harm receive immediate and appropriate intervention. Reflection questions. How do you think a GP can balance providing initial treatment for depression with knowing when to refer to a mental health specialist? What are the signs that would prompt a GP to refer a patient to a psychiatrist or psychologist for further care? In summary, general practitioners play a critical role in the early identification and treatment of depression in primary care settings. By using screening tools like the PHQ-9, prescribing medications such as SSRIs, and combining medication with psychotherapy, GPs can provide effective, holistic care for individuals struggling with depression. Regular follow-up and knowing when to refer to specialists are essential components of comprehensive care. In the next video, we'll discuss task shifting, where we explore how to train non-specialists to manage depression, particularly in low-resource settings. Let's keep it going, and I'll see you in the next one.